since the United Kingdom began the biggest vaccination programme in our history, and the public is coming forward at an extraordinary pace to get a jab to protect themselves, beginning with the elderly and the most vulnerable. With 138,000 recipients of the first dose and more joining them every minute, there's no doubt that we are winning and will win our long struggle against this virus. Which makes it all the more important that we hold our nerve this winter, because we're now in a race to protect us all while doing everything we can to keep the virus under control. And thanks to the colossal collective effort in November, we did bring the R below 1, we did get the infection rate down, but I must be frank with you, we're already seeing worrying rises in some parts of the country. Kent is still seeing rising infections. The number of cases in London is at 270 per 100,000 people. That's why we acted quickly by moving London into the third tier, tier 3 from today. And tomorrow, the Health Secretary, Matt Hancock, will announce the outcome of the latest tiering review. And so, like every other European country facing similar challenges, we've come to this moment, this great global festival, a turning point, a time of year that is of immense emotional, spiritual importance, but also a moment for us to exercise extreme caution. When we must remember that one of the most striking features of this virus is that it spreads invisibly from people who don't even have symptoms, which is in fact around 1 in 3 of everyone infected. And that's why, from the beginning, this virus has been so hard to fight. And that's why it's so important to follow the rules. And that's why this Christmas it's vital that everyone exercises the greatest possible personal responsibility. And having looked at the latest data, Scotland, Wales, Northern Ireland, we've decided that the overall situation is, alas, worse, more challenging than we'd hoped when we first set the rules. So, while it would not be right, we think, to criminalise people who have made plans and simply want to spend time with their loved ones, we're collectively, across the UK, governments at every level, asking you to think hard and in detail about the days ahead, and whether you can do more to protect yourself and others. We're keeping the laws the same, but we all want to send the same message. A smaller Christmas is going to be a safer Christmas, and a shorter Christmas is a safer Christmas. When we say 3 households can meet on 5 days, I want to stress that these are maximums, not targets to aim for. And of course, it's always going to be safest to minimise the number of people you meet. And that means that if you're visiting others over Christmas, we're asking you, in the 5 days beforehand, as early as this Friday, to reduce the number of people you're in contact with to the lowest possible, because obviously this virus spreads through human contact. If possible, don't travel from a high prevalence to a low prevalence area, and avoid staying away from home overnight if you can. Remember, the vaccine is on the way, and our aim is to inoculate everyone who is clinically extremely vulnerable or elderly in the early months of next year. So, if you're elderly, the best way to minimise your personal risk is to wait to be vaccinated before spending time indoors with others. And if you have an elderly relative, you might want to delay seeing them until they've been vaccinated. And whatever your plans for Christmas, please think carefully about avoiding crowds in the Boxing Day sales. And no one should be gathering in large groups to see in the new year. And remember, the rules in your local area will apply. In most places across the UK, I'm afraid that means you can't mix with other households indoors. And all the information about how best to protect yourself and your loved ones is being made available on gov.uk. So, have yourselves a merry little Christmas. I'm afraid this year I do mean little, but with the vaccine and all the other measures that we're taking, we do know that things will be better in this country by Easter. And I'm sure that next year, Christmas will be as normal as usual for every family in the country. And I'm going to hand over to Chris, Wheatley, CMO. Anything you want to add, Chris?
Thanks, Prime Minister. I just wanted to, in a sense, re-emphasise some of the points the Prime Minister has made, but from the point of view of doctors and other healthcare professionals, because I think everybody would agree with what I'm about to say, who are doctors, nurses and other healthcare professionals, and certainly this is the view of all the CMOs, Chief Medical Officers and Deputy Chief Medical Officers in the UK. It's very important to situate the decisions that people are taking, the actions that people take over the next 2-3 weeks in the fact that we do have a vaccine that will be protecting the most vulnerable to a very high degree of protection in the next 2 to 3 months. And that subsequently, as the vaccines rolled out to the general population, the risk of coronavirus circulating will begin to go down. So we are tantalising close to the stage where anybody who gets into trouble as a result of actions this Christmas would have been protected in the very near future. So it is very important people think about that when they make decisions over the next few weeks. And there really are, in addition to the standard rules and guidance that has been there for the whole time in all 4 nations of the UK, but certainly here in England, the guidance here, the tiering guidance the Prime Minister talked about, there are essentially 4 things to think about that are specific to the festive season over Christmas, as indeed to all the other major religious festivals, Hanukkah, for example, at the moment, previously Diwali and Eid. First thing is keep it small, keep it short, keep it local, and think of the most vulnerable people. Keep it small because the smaller the number of households that meet together over the festive season, the less transmission there will be. So smaller numbers in bubbles, smaller numbers that you meet in any other situation, all of this helps pull down the risk for your family, for your friends, and for the wider community. Keep it short because the shorter the period that people are together, the less risk there is of transmission occurring. Keep it local because people travelling from high incidence areas with a lot of transmission, to lower incidence areas, have the risk of actually passing on the virus. So wherever possible, keep it local. And in particular, think about people that you might meet, that your family might meet, or that one generation along people might meet, someone who you meet who then meets an elderly or medically vulnerable person who would very soon be protected, but at the moment is not, as a result of the vaccine that's rolling out. So just keep it small, keep it short, keep it local, think of the vulnerable, and that way we can reduce the risk of Christmas. We all accept there's an increased risk of Christmas. Nobody has hidden that at all at any point along this, but if we do this, we can reduce the risk further for everybody.
Thanks very much, Chris. Let's go to questions from the public and then the media. Let's go first to Teresa from Cambridge.
With a significant increase in positive cases and more areas entering Tier 3, plus the news of a new variant of coronavirus that could spread faster, what evidence can the government provide to support the mixing of households at Christmas is not detrimental to our lives, pressure on the NHS and economy?
Well, Teresa, let me go first and just say that, as Chris has said, nothing in this whole campaign against the pandemic has been without risk, but we have to make a judgment about partly about how people are going to behave anyway, people's natural instinct to want to see their families if they possibly can. And so what we're trying to do is to set the parameters that we think are sensible, and we've come up with a maximum that we think is sensible across the whole of the UK. But what we're saying today is that is a maximum, not a target. and we're saying, Theresa, that everybody should exercise personal responsibility, judging yourselves how best to reduce the contact, the meeting of other people that is the way of spreading this disease. And that's the way that we intend to minimise the effect of Christmas gatherings on the wider pandemic. It's about trying to reduce that contact and make sure that everybody is as cautious and as personally responsible as possible. Gordon, I mean, alas, I respectfully got to differ with your characterisation of this approach. It remains, alas, much against, I'm sure your instincts and everybody's instincts. It remains a highly prescriptive approach. We are saying very clearly that you can't meet in more than 3 households for more than 5 days. I don't think there's ever been anything like it. Probably not since Cromwell's time, or heaven knows, when we've had something like this before. What we are saying is, because we do recognise that the human spirit will naturally want to celebrate Christmas and all the other festivals that people want to celebrate, that you cannot constrain people too much. You have to be reasonable. So what we're also saying is that if we want to stop the spread of the disease, which I think everybody does, then we need to look very carefully at the next few days and work out exactly how we can minimise contact, minimise the amount of time, and minimise the risk to the elderly and vulnerable. And that's what the guidance is there to do. It's there to help people to exercise personal responsibility over the next few days, and I hope it's useful.
So we all hope that will come through, but like the Prime Minister, the right thing to do is to wait and see what the regulator says.
Thanks very much, everybody. As I said before, have yourselves a merry little Christmas, but this year, alas, preferably a very little Christmas. But with the vaccine and everything else that we're doing, next year, we hope it will be back to Christmas as normal for everyone. Thank you.
The Prime Minister Boris Johnson there, alongside the Chief Medical Officer Chris Whitty, setting out the plans for Christmas. Christmas isn't cancelled, but everyone urged to use extreme caution. In the words of the Prime Minister, a smaller, shorter Christmas is a safer Christmas. He advised people to reduce the number of people they come into contact with in the 5 days before Christmas. If possible, don't travel from a high prevalence area to a low prevalence area, and avoid staying away from home if you can. And advice to those who have an elderly relative from the Prime Minister. He said that you might want to delay seeing them until they have been vaccinated. A pithy message from the Chief Medical Officer, Chris Whitty: keep it small, keep it short, keep it local, and think of the most vulnerable people. Our Deputy Political Editor, Sam Coates, is in Westminster. So where does this leave us then, Sam?